A 10-year-old boy was brought in by his mother for weight problem. He was delivered by cesarean section for macrosomia, birth weight 4.2 kg, and he had normal developmental progress thereafter. During examination, his weight was 60 kg with height 125 cm. His fasting blood sugar was 8.5 millimole per liter and random blood sugar is 12.1 millimole per liter. What are the clinical and laboratory features that suggest this child might have type 2 rather than type 1 diabetes? Before that, let's compare these two diabetes. Type 1 usually has a younger onset, less than 30, whereas type 2 is an older onset. Type 1 diabetes is lean, whereas type 2 associated with obesity or overweight. The symptom duration for type 1 is within weeks, whereas type 2 is for months or years. No family history of diabetes in type 1, but significant in type 2. Insulin deficiency at first in type 1, but partial insulin deficiency initially in type 2 and reduced in advanced state. Low C-peptide in type 1, but high C-peptide in type 2. Type 1 is autoimmune disease, but type 2 is not. Positive immune marker found in type 1, but not in type 2. More than 90% type 1 associated with HLA-DR3 or DR4 gene, but no HLA link in type 2. First clinical features are the weight, height, and BMI for patient. The patient is very heavy for his age. According to the WHO definition, the patient is obese, and obesity increased peripheral resistance to insulin-mediated glucose uptake and predisposed to type 2 diabetes. Second feature is macrosomia, which increases the risk of developing obesity, impaired glucose tolerance, and diabetes in the offspring. The fasting blood glucose and random blood glucose level of this patient is high and is diagnostic for diabetes.
We will choose metformin as antidiabetic drug for him because metformin is widely prescribed antibiotic drug and also a first-line drug for type 2 diabetes according Malaysian CPG 2022, and it's remain the only one oral medication approved used in children today. And metformin also can use both in monotherapy or in combination, and also cheaper, safer, and no hypoglycemic symptom, and also possible benefit on cardiovascular outcome.
Other issue that need to be addressed with him is the macro and microvascular complication, as youth tend to have more rapid complication compared to adults. To avoid risk factors for complication, he need to have lifestyle adaptation including diet, exercise, and drug therapy, and have to be compliant of medication. We also need to consider his social economic status, as it is also important as part of his management.